A topic that isn't really touched upon as much as it should be would be barbed needles. Now, this is something that I kind of came across just from my own practice, wondering why this was happening. And I always just thought to myself, oh, the needle's getting dull. So sometimes, I'd be using my needle, I'm doing a procedure where I maybe double block somebody, and then later on it's a longer thing or something, or I don't get to that area as quickly as I expected. I go back to anesthetize them again, or perhaps maybe I missed a block, for example. And that third penetration, sometimes it's really, there's like a lot of resistance as you're going through the tissue. You're almost feeling as though you're tearing the tissue, which was disconcerting to me. But again, I attribute it to the needle being a little bit dull. Now, that isn't really what's going on. So what's going on is needles have a bevel at the end of them. I'll try to zoom in on this for you, which, you all know what this is anyways, but when we look at the bevel, we need to be aware that there's all different shapes of bevels. So there's different styles, which again, I had no idea. But there is an ISO standard out there in the world that says that when needles are manufactured, they're not supposed to have barbs. Now, what is a barb? Well, a barb is basically a curl on the end of the needle. So it's like a little curl back, almost like a fishing hook, if you think of what that would look like. If you blew this up and looked under the microscope, that is kind of what you'd see. And you wouldn't even need a microscope, actually. You could just look with your magnifier and you'd see it. But basically, that happens in every injection. I found that actually very interesting. So every single injection, you end up with a barb on your needle. Now, do we reuse our needles? Absolutely we do. I think we're all guilty of that, and we don't think about it. But it is something where, for your patients, it'd be kind of you to consider changing them, because after that initial injection, like I said, that initial penetration, the needle will be barbed, and we'll talk about that in a little bit. So what causes barbs? Well, just contact with tissue oftentimes is enough, but definitely bony contact. So when you're doing blocks, that is certainly a time when this is going to happen. The bevel characteristics, like I said already, the different types of bevels. So some will have like a scalpel bevel, which has basically like a little different shape to it than the regular style of bevel. Also, the quality of manufacturing, clearly. So if you're using cheaper needles, maybe a little different alloy in them, they're going to bend easier or become barb easier. And then, as I alluded to before, just using your needle over and over and over without changing it, again, that's going to lead to more barbs in the needle. As far as the type of barb that forms, you can get two types. So you can have either an outward facing barb, so our bevel is kind of going this way, in case you can't really see it on here. The outward facing barb would curve out this way. So it kind of curves away from the lumen of the needle. That is the most dangerous one. And by dangerous, I mean it's the most prone to dragging back on the tissues as you're pulling your needle out, or I guess cutting too as you're moving forward. So what's going to happen is you have a chance of causing trismus from damaging muscle fascicles. You can get intraneural bleeding, hematomas, or scarring of the perineum, which can all be the result of these barbs. And of course, that can be pretty detrimental to your patients. So think twice about this. Don't, be using a needle multiple times thinking it's okay. It's only one more injection, no big deal. It certainly can be, and the research is there to back that up. So with these, you could also have an inward facing barb. So that's when maybe the tip of the needle is going to curl over, kind of like bending in toward the lumen, if that makes sense. Now, you're very rarely going to end up with a permanent nerve disturbance from a barbed needle. Now, you can get certainly paresthesias or dysesthesias. Are you going to get anesthesia? Very, very unlikely. Now, the reason that that's very unlikely is that the lumen of this needle here, which is a 25 gauge long, this is one that I'll use for my blocks, is 0.45 millimeters in diameter. The lingual nerve is roughly about 1.8 millimeters in diameter, and the inferior alveolar nerve is about 3 millimeters in diameter. So thinking about that, are you going to be able to kind of totally damage the nerve with a barb that's coming off of here? No, but you can definitely do some damage. So just really, really think about this, put it on your radar. How do you prevent doing this? Well, again, prevent contacting bone at times. So when you get comfortable enough with the IAN block, I know some people are going to say hit bone every time. Do you need to? Not necessarily. If you have a pretty good idea of where your landmarks are, your depth of penetration, you're going to be able to get pretty much right where you need to be with that block. If you can avoid bone during injections by using proper technique, again, that's good. So say if you're doing a PSA block, maybe you're contacting bone a little bit too early because you're not angling the needle correctly. That's something, if you work on that, you're going to have fewer contacts with the bone. Now, again, this is applying more typically to blocks because say you're doing an infiltration with a barb needle, yeah, it's more discomfort afterwards, but you don't have any major nerves in the area that are going to be affected by this too terribly much. So again, the lingual nerve, inferior alveolar nerve, those are the two that we're looking at more often as giving us trouble. So I have attempted here to make a barb on this needle just to try to show you what this would be. Now this is an outward facing barb. Are you going to be able to see it on here? I'm not so sure. We'll definitely find out when we're editing, but if I can blow this up so you can have a look at it, you're going to see just exactly what this looks like. Now, this was from contact with a metal drink container, so this may be pretty intense for what you'd see in the mouth, but again, this is the idea that we're looking for, and certainly if it's exaggerated on here, that's good because you'll get the idea of exactly what I'm trying to describe. So for those of you in the crowd that are a little bit more frugal, and I can say this because I'm a dentist myself, I don't know what it is. Dentists seem to be that type of personality. They just like to save money. And nothing wrong with that. But let's say that you're injecting and you hit bone and you think, oh, okay, yes, I took this course. I remembered, this thing about barb needles. Oh, but man, I don't want to throw out that needle. It's so expensive. Hopefully you're not thinking that way, but maybe you are. If that's the case and you have a piece of gauze laying around, this is a little trick that you can use. So you can kind of drag your needle across the gauze, and what you'll see is, see how it's catching on there? That tells you that you've got a barb on the needle. So basically you don't want to be putting that back in the tissue. So at this point in time, you're just gonna have to suck it up, take one for the team, and throw out your needle, put a fresh one on, and stomach that, 20 cents or whatever they cost. So yeah, that's basically the tips for you here with barb needles, something that I hope now is in your mind a little bit more than it used to be. Again, you're going to feel it. You're going to know when it's happening, and you should feel kind of bad about it when it happens because it's avoidable, right? We don't need to do this to our patients. And really, truly, you're protecting yourself as well, not just your patient. You have a higher likelihood of causing some sort of nerve disturbance just from your injection, not even the procedure itself. So take care, and we'll catch you in some more videos.